to just kind of tie it all together so I'm not here too long. Um, Too late. These medications are very, very important. They're very, very important. And they're effective. So the right medication for the right patient, we each have different brain chemistry, so something that works for me may not work for somebody, might make them feel worse. It is something that you do need to discuss with your doctor for those reasons. And there might be other considerations, such as drug interactions with other prescriptions you might take for health issues. I don't know. I don't, I didn't get to that portion of my nursing program to really get into the pharmacology of antidepressants. So we got into the pharmacology of blood pressure medication, diabetes medications, and other types of medications. But the psych aspect in nursing, I think, was going to be in the third semester. And after the second semester, I was out. My family had to move, and some other things happened that made it not possible for me to stay. And it affected my grades. So I was taken out of the program because of that. But so the reason why I'm saying that is that I didn't do any in-depth studying enough, even, this many years later, to know off the top of my head any kind of interactions that antidepressants may have with common medications. Do want to mention turmeric, though. I don't understand why people don't talk about turmeric. I mean, it wasn't hard for me to find information about turmeric. And I think that maybe prescribers and doctors, there's so much for them to be aware of that that's probably like the last thing that they think of. But just be aware. Turmeric. Now, this is not if you make a tea. If you're making golden milk or you're having a chai tea that has turmeric in it, or if you're using the spice, that is not the same as taking a supplement. You're probably fine. Like I said, I am not a registered nurse, and I am not a prescriber. I'm also not a pharmacist. So check with your pharmacist. That seems like it's a little worrywart, but a little, too much worrying, but it doesn't hurt to ask the next time you're at the pharmacy. And those papers that you get with your drugs, that maybe you've been taking your medications for a while and you throw them out, or you shred them and you haven't read them in a while, just pick them up. Yeah. The reason why I bring up turmeric's not evil. Turmeric's awesome. I'm going to move my hand here. Sorry. Ugh. On a positive note, I've been noticing that my videos that I've been taking the last couple weeks are not an hour or two long. I'm approaching 40 minutes, so I'm going to wrap this up. I'm going to have to do another video. So one, turmeric interferes with your, I want to say liver. So not to get into an anatomy and physiology lesson, but our medications, in order for them to be available for our body to use them, they become metabolized. They become metabolized in your, well, sorry, I got it backwards. Metabolized means when they get filtered out and removed from your body, which I didn't know. I remembered it backwards. So, what does that mean? What does this mean? Why am I talking about turmeric? The reason why I bring it up is if you take a supplement for your joints and it happens to be turmeric, just let your doctor know. And if your doctor just never learned about it, it just basically interferes with your body's ability to metabolize medications that are metabolized through your liver. And so that doesn't mean your body's ability to absorb and use the medication, which is what I falsely thought, as I haven't been in nursing school since 2016, so we're coming up on a decade. So there's things that I'm forgetting, right? And so I basically just remembered it backwards. So metabolizing the medication means it's now taking it out of your system. So that may not, it might interfere with your body's ability to use it. I don't know. But it is a concern for ADHD. It is a concern for antidepressants because there is a thing called serotonin syndrome. And that is it's not something to get super scared of, that it's automatically going to happen and you're going to die. But it is a concern, and it is something to learn about so that you minimize your risk if you take certain antidepressants, such as SSRIs, serotonin reuptake inhibitors. My medication that I do want to talk to you about, Venlafaxine, is it also, besides it being a serotonin reuptake inhibitor, it also, was it norepinephrine? It does two things. It's basically like two meds in one. It also gives you increased energy. So, which is fantastic. It does, for somebody, you have to, this is why it's very, very important to discuss this. And I'm just talking from a practical standpoint. So, the only reason I bring them up is because of safety issues. Not for you to be scared, but for you to be aware. I mean, all of these things are information and tools you're putting into your toolbox. You want to be an informed person who's managing their conditions. And being aware helps you. Just so you're minimizing your risk for some of these more serious things that could happen. Like serotonin syndrome. So serotonin syndrome is when the amount of serotonin that's available is too high. Too high. So when I was talking about your liver, I'm going to double check. I'm going to look it up to make sure I'm giving you the right information. But your liver metabolizes, means removes the excess. It removes the excess of the medication. Is this part of its function? So your body has used the medication. It's done its job. Your serotonin that is too low because of a chemical imbalance, because of your diagnosed depression, which otherwise, depending on how severe, you may not want to continue to live. So I think it's very, very important to mention that these medications are a very important tool for patient safety. So you might think that I'm going to scare you away from medication. No, not at all. I'm not pro and I'm not against. I'm just for knowledge. I'm just for becoming aware. Because the more knowledgeable you get, the less scary it is, right? And also the safer you are, because you'll know to take better care of your health, and it makes things easier for you. So what happens if you take antidepressants and you happen to take turmeric? So if your liver, after your brain has used the excess serotonin, so without getting into an A&P lesson, too late. I'm holding my camera with my bad arm. For those of you that's new, I'm not going to get in big thing again. I fell a few nights ago, and I kind of tripped on something in the dark. My body twisted, and I fell sideways, and I landed on my elbow. I thought it got twisted behind me initially because it was dark, and it happened so very, very fast that I was going on how it felt after. I thought it got twisted, but I think I just, like jackknife, just landed straight onto my elbow. So yeah, my elbow, I actually thought I broke it or fractured it, and luckily the next day I could tell that I did not, thank goodness. I mean, why was I talking about that? Yeah, I just think it's important. I think it's important to know. The Venlafaxine, which I came here to talk to you about, this is the equivalent of going all the way to the store and getting all the other things that you need, and then driving away, and then realizing on your way home that you didn't get the thing you went there to get. And the thing I came on here today to talk about was Venlafaxine. I'm going to do a different video on that. There is like almost no half-life. And it's very different from other antidepressant medications. So if you take one thing away from this, just know, and I'm back on my medicine and I'm calmer. So that's what's important. Thinking is clearing up. It's only been one day. The reason why I brought that up is because one day of going without it, the most close description of what I could say it feels like within 24 hours of stopping Venlafaxine, unlike other antidepressant medication, which you might have taken for years. I took SSRIs since probably 2008. So I think all of us have forgotten to take medications for a few days. It's just inevitable, especially if you have ADHD and you're distracted and you have poor working memory and you have poor executive functioning and a lot of your cognitive energy is just spent because you're trying to manage juggling everything that's like easier for other people. So it's easy to lose track and be able to be compliant with filling your medication on time. It's very challenging. So you pair that with, you take a patient and you give them a medication like Venlafaxine. Now, I think that it's only 2 medications. I think that I learned that there are only 2 in that particular class that are like this. Venlafaxine and one other one. So there is a danger for severe withdrawals, like immediately. And this is what I started saying a minute ago. And for me, it feels like I'm having a bipolar manic episode. Or it's like a mess. It's a mess. It's a mess. Because if your brain has been on an antidepressant to level out its neurochemicals to work properly, and it's adjusted to that, and it's balanced to that, and you suddenly remove it, you're not just going to go back to where you were. You might think, oh, you'll just go back to being depressed, like how you were before you started. No, because your brain has now adjusted to it. So it's not just going to go back to this level of depression you were at, or mood swing, or whatever it was. It goes way down. It's scary. It's scary. So for me, it's like having some kind of depressive / manic episode. And I don't mean in the good sense. I'm not like joy and all this energy and wanting to stay up all night. Like, I mean it in the bad sense, like agitated, upset, mood swinging, wanting to throw shit, then throwing shit, yelling, screaming, little things that are like normally something that pisses you off or stresses you out, but you can like let it go. It basically makes you like fucking unhinged. And yeah, I had a day like that yesterday. So the video that I posted 2 yesterday. Thank you for bearing with me if you're still here. I appreciate it. It's kind of, I'm still a little off. Yeah, that was pretty messed up. And I started having the shakes and I couldn't think straight. And yeah, I was super embarrassed, but I knew it was only going to be one day. Again, it happened. Did I let it go? I had this feeling. Oh no, that was my ADHD. So my ADHD med was overdue. That's fine. If I have gone without my ADHD meds for a few days, it makes it so I can't think straight. It makes it so I'm out of it, and that's fine. It's not ideal, but that's fine. having a medication that you suddenly go without, and all of a sudden you're having what feels like, what I'm speculating would be a manic episode for somebody who has bipolar. I don't know. I know that type 1 and type 2 are very different. I would say probably milder, although I have had people close to me in my life that were diagnosed with bipolar. One person, I think they were about to diagnose her with it and they changed it because it was very similar. They were sorting it out, and I can't remember if they diagnosed her with that and then changed it later, but it was type 2, which I know some things about, but it's not the same as type 1. Like, you'll have episodes, so you'll have periods where you're in a depression, and then you'll have these periods where you have a manic episode. And the stereotype of what somebody might think a manic episode is versus what they actually are can be two totally different things. You might think that that person's like very creative and very happy and up all night, and they might end up having some of that. I don't know. I'll have to watch some of, well, there's another content creator that I enjoy, and I haven't watched her content recently. But yeah, she has schizoaffective disorder, schizo. Go look her up. She's amazing. And she shares her experience. And so it is like type 1 bipolar that happens to have some schizophrenic symptoms, like some hallucinations. So it's a lot. It's a lot. I just think she's amazing. She's amazing. And I'm very grateful for her that she's here and sharing her story. I think it's important. The stigma's got to end, right? It's got to end. People live with these things. And it makes sense. Think about it. Why shame somebody or look down on somebody because your brain, which is way more complicated than any other organ in your entire body, it's the master computer, right? It regulates the autonomic nervous system. It regulates the sympathetic nervous system and parasympathetic nervous system. It regulates things that are automatic, like your breathing, and, well, you can kind of control your breathing too, but it regulates, bodily functions. But your brain also is the computer we think with, is, like I was saying, with ADHD and with mood disorders, there is so much that when your brain is functioning properly, if you're a neurotypical person who also, by the luck of God, does not also have mental health issues, I am not saying, nor should anyone say, that you don't struggle at all. Because I really think that we probably all struggle with some kind of mental health or stress or burnout at some point in our life, even if we aren't genetically predisposed or have a diagnosed mood disorder or mental health condition. There are traumas that people experience in life, and there's CPTSD, and there's things that even the most physically mentally healthy person would struggle with, and should probably get counseling, because even the healthiest person would struggle with. And the day-to-day stresses of life could push anyone. But if you have a mental health condition or neurodivergence, it makes functioning challenging, very challenging. Many people with ADHD either can't work or are underemployed. And I want to say 60 to 70% of autistic people are either unemployed or underemployed. And a similar figure for people with ADHD. I wonder how many people with depression have employment problems. I haven't done that research yet. And as I go, I know it's very distracting when in some of my videos I'll put like little factoids. I'll put like little things, sorry. I'll put like little, I'll go find, like as I'm editing, I'll just go, oh, and I go, you know, the NIH, the CDC, you know, medical journals, studies, you know. I try to find things from the most credible sources possible. It's important. I'm not just going to grab something from Wikipedia, and I love Wikipedia. I think there's a lot of good information, but when you're talking about things that are important, like what we're talking about today, medications for your mental health, they're very important to talk about these things. Venlafaxine. I must still be symptomatic. It must be like, I think I've been without my ADHD meds for 2 days. So I'm still kind of like, my mood's 100% better than yesterday. Like, I almost feel like my normal self. I feel out of it. Oh man, that's scary when that happens. I don't like it at all. I don't like it at all. I do have to say the Venlafaxine that I'm on, aka Effexor, I may post graphics that like warning, and it may seem very clickbait, or it may seem dramatic, or I'm trying to scare you away from medications. I never want to do that. And even if it may appear on the outside that way, it's just because there is something that I think is very important for your health and wellness to be aware of, so that you make good, sound choices for yourself. Only you and your doctor know what you should do. It's just, there is an added safety measure of discontinuing it. That's all. So all of these scary things that I'm talking about with this particular medication are if you suddenly stop taking it. Ah, man, it's so simple in my head before I start talking, and then I end up talking in circles. So, and you guys are amazing. Hakan, you tell me that you follow me. A lot of times, like where I'm at, like right now, while recording, I get self-conscious, and I know that I'm not supposed to, and you guys tell me not to. It's such an ingrained habit that I'm unlearning it. It's going to take me a while. It's such a conditioned response for me to go, oh, I'm doing it again, because it pisses people off. So you get it's annoying, and people have a hard time paying attention to you, and especially if they're impatient. So I'm conditioned to stop it. So that's going to take a while to undo. That's going to take a while. I might do a live later today. Ooh, I'm glad I just thought to look at the clock.